are a group of medical technology students, and we are going to present to you a microbiology case study entitled 37-year-old male with cyclic fever and severe headache. The introduction of this case will be presented to you by Andrea Ruby.
So in this case, there is a 37-year-old Indian male goes to the emergency department because of having a cyclic fever with a temperature of 102 to 103 degree Fahrenheit. Recently, he went to India for 2-month vacation. So mention travel history, which is nag-vacation siya sa India within 2 months and he is bothered if he has malaria because he is experiencing symptoms same as the manifestation of malaria. He denies other symptoms and there is no complaints of any suspicious ingestion or sick contacts during the trip. Sabi niya wala daw siyang nakain na hindi okay while sa kanilang trip. And his other family members are all well and healthy. So, to sum up the case introduction, for the patient history, he has recent travel and 2 months vacation to India. And these are the symptoms that he is experiencing, which includes the cyclic fever, which is 102 to 103 degree Fahrenheit or 38 to 39 degrees Celsius, chills or panglalamig, fatigue or pagka-feel ng pagod, and also the severe headache or grabing pananakit ng ulo. So for the physical examination, he is ill appearing with dry mucous membranes, but there is no light or aversion. There is no light aversion or neck pain. So for the laboratory test, it was determined that he has normal WBC count, which is hindi naman sumusobra sa normal range ng WBC. And but he has elevated liver enzymes in which ang kanyang alanine aminotransferase ay 383 units per liter and the aspartate aminotransferase are 282 units per liter, which is above normal. So for the laboratory identification, they collected blood and CSF as their sample for gram staining and culture, which will be sent to the microbiology laboratory. And he was also requested to have additional tests for influenza and viral hepatitis and malaria.
So here are the pictures in the microbiology department. So first we have figure 1. It shows the gram stain from blood culture viewed from microscope using the oil immersion objective. And it was shown that there is an appearance of large rod-shaped organisms there. And the microorganism have able to attain the counter stain, which signifies that it is a gram negative. Next. So here is a picture. Figure 2 shows the growth of small and colorless colony in the McConkie agar after 24 hours incubation in carbon dioxide at 35 degrees Celsius. The colony tend to be colorless due to its lacking ability to ferment lactose. And this circled here are the colonies. Next. So in figure 3, it is a picture that shows the growth of transparent green colonies with black centers on the hectowing enteric agar after 24 hours incubation at oxidant at 35 degrees Celsius. So we can see here that it is transparent green and has a black center. So next. So since we have isolated the organism in different media, additional testing was performed in order to further identify what is the microorganism. So the laboratory used the Malditov mass spectrometry to further identify the group of the microorganism, and also the isolate was sent to the public health department for additional testing via molecular typing methods. By the use by the usage of molecular typing methods, we can determine the serotype of the said organism. So based on the inoculation in different medias and additional testing, these are the findings and diagnosis. So first, we have the testing for influenza, viral hepatitis, and malaria. The results were all negative. For the identification of microorganism using the Maldito mass spectrometry, it was identified that it is a Salmonella group. And by the usage of molecular typing methods, it was also determined and identified that it was serotype type B. So the diagnosis of Salmonella serotype type B was confirmed. In the inoculation in the different medias, in Macon case, the colony tends to be colorless because Salmonella typhi tends to lack the ability to ferment lactose. As for the Hictoin enteric agar, this can be differentiated with other serotype of Salmonella, which is the Salmonella paratyphi. So Salmonella typhi tends to produce transparent green colonies with black centers, while the Salmonella serotype paratyphi do not produce black centers. So next was the discussion part, which will be presented to you by Chinkay Mercado.
So, for the discussion, a 37-year-old man was diagnosed by a Salmonella serotype typhi. Clinically, in the absence of gastrointestinal manifestation, it occurs with high fever and headaches and develops a more serious disease than other serotypes of Salmonella. Traditionally, serotyping of the somatic antigen groups as D1, the H. flagellar, and the VI antigen is present. In terms of confirming the diagnosis of Salmonella and defining the serotype name, applying results to the Kaufman-White scheme is useful. Salmonella typhi are bacteria that infect the intestinal tract and the blood. The disease is referred to as typhoid fever, which is the cyclic or periodic fever, a genetic conditions that are very rare. Next. Salmonella, it is a member of Enterobacteriaceae family and also a gram-negative. Salmonella is commonly isolated from blood rather than fecal. Dehydration or invasive salmonella infection can be seen. It is because when salmonella infection become invasive or severe, the organism will go through our bloodstream so that if it is tested for culture, it will be positive. It will also affect the liver enzyme of the infected person, such as elevated alanine aminotransferase, and this can be usually seen to person who experience an enteric fever. So in relation to our patient, he was tested positive for blood culture and its liver enzymes, which are the alanine aminotransferase and aspartate aminotransferase, is elevated. Next. So these are the pictures of our salmonella, and it is a gram negative and rod shape. Next. So, so for the causes of salmonella, people and animals can carry salmonella in their intestines and their feces, and these are also known as reservoir. The bacteria often spread through food or drink contaminated with feces or person-to-person contact. So in relation again in our patient, maybe during his 2 months travel, he has eaten some foods or drinks that are contaminated with the pathogen. So a person can also require Salmonella typhi if he or she has a travel history, especially in developing countries. So these are the next. So these are the common food sources of Salmonella infection, include raw and undercooked meat, processed foods, and poor hand washing. So we can also get Salmonella directly through poor hand washing because we might pass along the bacteria by not washing our hands well, and usually after using the bathroom. And these are the symptoms of salmonella. First, we have nausea or vomiting, diarrhea and fever. And again, similar to our patient, he also had a high fever. And if you become infected with salmonella, these symptoms typically appear between 6 and 48 hours after exposure to the bacteria. Next.
So for the treatment, if you have Salmonella typhi, it is necessary to take antibiotic, and your doctor will decide which treatment is right for you. So some doctors will recommend ceftriaxone. It is an antibiotic used to treat bacterial infections, and the doctor also recommended the IV antibiotic, which he took for 7 days. Since the susceptibility testing showed intermediate results for ciprofloxacin by this diffusion, and also the azithromycin was found to be susceptible with an minimum inhibitory concentration of less than or equal to 16 microgram per milliliter.
So that is for the presentation of our case study, and the reference is here.
So we hope you, thank you guys. We hope you learned something, especially Salmonella typhi, which belongs to the family of Enterobacteriaceae.
So don't forget to like and share our video and click the notification bell for more updates and for more upcoming videos.
That's it for our video,
Bye.
guys.